Which of the following structures is primarily responsible for gas exchange in the lungs? A. Bronchioles. B. Trachea. C. Alveoli. D. Bronchi. The correct answer is C. Alveoli are tiny sacs in the lungs where gas exchange occurs. They have a large surface area and are surrounded by capillaries, facilitating the diffusion of oxygen into the blood and carbon dioxide out of the blood. During inhalation, which of the following occurs in the diaphragm? A. The diaphragm relaxes and moves upward. B. The diaphragm contracts and flattens. C. The diaphragm relaxes and moves downward. D. The diaphragm contracts and moves upward. The correct answer is B. During inhalation, the diaphragm contracts and flattens, increasing the volume of the thoracic cavity and allowing air to flow into the lungs. What triggers the release of oxygen from hemoglobin at the tissues? A. High partial pressure of oxygen, PO2. B. High partial pressure of carbon dioxide, PCO2. C. Low concentration of carbon dioxide. D. Low temperature in tissues. The correct answer is B. At the tissues, high PCO2 and low PO2 create conditions that promote the release of oxygen from hemoglobin, a phenomenon known as the Bohr effect. What is the primary factor controlling the rate of respiration in response to high levels of carbon dioxide in the blood? A. Chemoreceptors in the lungs. B. Chemoreceptors in the aorta and carotid bodies. C. Stretch receptors in the bronchioles. D. Baroreceptors in the alveoli. The correct answer is B. Chemoreceptors in the aorta and carotid bodies detect high levels of carbon dioxide in the blood, triggering an increase in the rate and depth of breathing to expel more CO2. How does carbon dioxide primarily travel in the bloodstream? A. As dissolved gas in plasma. B. Bound to hemoglobin as carbaminohemoglobin. C. As bicarbonate ions. D. Directly inside red blood cells. The correct answer is C. Most carbon dioxide is transported in the bloodstream as bicarbonate ions, HCO3 ghatav, which are formed when reacts with water under the influence of carbonic anhydrase. Which part of the brain is primarily responsible for regulating the respiratory rate? A. Cerebellum. B. Medulla oblongata. C. Hypothalamus. D. Cerebrum. The correct answer is B. The medulla oblongata contains the respiratory centers that regulate the rate and depth of breathing by responding to changes in blood levels. Which of the following best describes the function of surfactant in the lungs? A. It increases surface tension in the alveoli. B. It decreases surface tension, preventing alveolar collapse. C. It acts as a lubricant for the bronchi. D. It absorbs excess carbon dioxide. The correct answer is B. Surfactant reduces surface tension in the alveoli, preventing their collapse during exhalation and ensuring proper lung function. How is oxygen carried from the alveoli to the tissues? A. Dissolved in plasma. B. Bound to the ion of hemoglobin in red blood cells. C. Bound to carbon dioxide. D. As bicarbonate ions. The correct answer is B. Oxygen is primarily transported in the blood by binding to the iron atoms in hemoglobin molecules within red blood cells, forming oxyhemoglobin. Which law explains the inverse relationship between the pressure and volume of a gas during breathing? A. Dalton's law. B. Boyle's law. C. Henry's law. D. Fick's law. The correct answer is B. Boyle's law states that the pressure of a gas is inversely proportional to its volume. During inhalation, the increase in thoracic volume reduces pressure, allowing air to flow into the lungs. Which of the following structures serves as the primary muscle responsible for quiet breathing? A. Intercostal muscles. B. Diaphragm. C. Scalenes. D. Abdominal muscles. The correct answer is B. The diaphragm is the primary muscle responsible for quiet breathing. Its contraction increases the thoracic cavity's volume, facilitating air intake. What is the chloride shift in the respiratory system? A. The exchange of chloride ions for bicarbonate ions in red blood cells. B. The exchange of sodium ions for chloride ions in the alveoli. C. The diffusion of chloride into the alveoli during expiration. D. The active transport of chloride ions out of the lungs. The correct answer is A. The chloride shift is the exchange of bicarbonate ions for chloride ions in red blood cells, which helps maintain ionic balance as is transported in the form of bicarbonate. In which part of the respiratory system does the majority of airway resistance occur? A. Alveoli. B. Trachea. C. Bronchioles. D. Larynx. The correct answer is C. The bronchioles, being narrower airways, contribute to most of the airway resistance due to their small diameter and the smooth muscle regulation of their lumen. Which of the following gases has the highest affinity for hemoglobin? A. Oxygen, O2. B. Carbon dioxide, CO2. C. Carbon monoxide, CO. D. Nitrogen, N2. The correct answer is C. Carbon monoxide has a much higher affinity for hemoglobin than oxygen, which is why it is highly toxic. It prevents oxygen from binding and being transported to tissues. Which component of hemoglobin directly binds to oxygen? A. Globin protein chains. B. Heme group. C. Iron, Fe2 jod. D. Carbonic anhydrase. The correct answer is C. The iron, Fe2 jod. In the heme group of hemoglobin is the site where oxygen molecules bind for transport in the bloodstream. Which of the following conditions leads to hypoventilation? A. Anxiety attack. B. Emphysema. C. Metabolic acidosis. D. Pneumonia. The correct answer is B. Emphysema, a chronic lung disease, causes hypoventilation by reducing the surface area available for gas exchange and making it difficult to fully exhale, leading to buildup. What drives the movement of oxygen from the alveoli into the blood capillaries? A. Osmosis. B. Facilitated diffusion. C. Active transport. D. Partial pressure gradient. The correct answer is D. Oxygen moves from the alveoli into the blood capillaries down its partial pressure gradient, from an area of high oxygen concentration to an area of lower concentration. Which of the following lung volumes cannot be directly measured by spirometry? A. Tidal volume. B. Inspiratory reserve volume. C. Residual volume. D. Expiratory reserve volume. The correct answer is C. Residual volume, the amount of air remaining in the lungs after maximal exhalation, cannot be measured directly using spirometry. Which structure prevents food from entering the respiratory tract during swallowing? A. Larynx. B. Epiglottis. C. Vocal cords. D. Uvula. The correct answer is B. The epiglottis is a flap of cartilage that covers the opening of the trachea during swallowing, preventing food from entering the respiratory tract. Which of the following conditions results in decreased lung compliance? A. Pulmonary fibrosis. B. Asthma. C. Bronchitis. D. Pneumothorax. The correct answer is A. Pulmonary fibrosis leads to decreased lung compliance because the buildup of fibrous tissue in the lungs makes them stiffer and less able to expand. Which respiratory disorder is characterized by hyperinflation of the lungs and difficulty expelling air? A. Chronic bronchitis. B. Emphysema. C. Pneumonia. D. Tuberculosis. The correct answer is B. Emphysema is a chronic lung condition where the alveoli are damaged, leading to hyperinflation of the lungs and difficulty in expelling air, causing shortness of breath.